Is it okay to take ibuprofen before running? So I don't know if you caught this recently, but there was a little bit of controversy about Advil, which is a company that make ibuprofen, and they were doing a promotion with a couple of influencers. I think it was a few of them all at once about using Advil as a sort of training aid for runners. So these guys, Adam and Mika, who seem to be a couple of people who are fairly good at running, they did a promotion where there was a reel that was talking about having period pain and then taking Advil and then being able to push through and go out and do your training session. And then there was another one by this Michaela Basai lady who did a reel similarly. And the sort of gist of it was, pain is inevitable. And then she sits down on the bleachers and then she takes a couple of Advil and then she sort of looks all like determined and goes back out and finishes her workout and says something like, nothing works faster. And then she can push through. So the sort of idea with both the reels is that if you take the ibuprofen, if you take the Advil, you'll be able to push through and complete your training session. Now, in both cases, like these guys, they have about 100,000 followers each. So we're not talking about, world famous athletes here. But there was quite a lot of pushback against it. I heard a lot of people kind of in my sphere of influence talking about how irresponsible it was of Advil and how dangerous it was to be promoting Advil as a training tool for runners. And this was a bit of a throwback for me because to me, taking ibuprofen or NSAIDs, which is like non-steroidal anti-inflammatory drugs, and other kind of stuff like that, like over-the-counter painkillers that are like anti-inflammatories, it's quite an old school strategy. It's been around for a long time. When you go to the running club, there'd always be one runner who sort of swear by it because it would reduce their muscle pain afterwards. They would recover quicker, they'd race better and all this kind of stuff. So I was kind of saw it in that light as kind of this old school strategy. So it was quite interesting to see it come up as a fairly trendy topic and controversial thing. And certainly, through my career as a physiotherapist, whenever someone would mention it, I would just suggest that, the main thing for me is when you are training, so when you're running or strength training or whatever you're doing, you're trying to create some kind of like micro trauma and damage to your body that your body then adapts to. And then there's a super compensation. And the immediate response of the body to that micro trauma is an inflammatory response. That's part of the cascade of events that eventually leads to the healing of that micro trauma. And then the super compensations are making it stronger than it used to be. And that's where the training effect comes from. This is how we get faster, stronger, and more resilient. So if you're taking ibuprofen or non-steroidals or things like that regularly, each time you do, you're essentially blunting that response in my mind. So logically, it didn't make a lot of sense for this to be kind of a regular behavior for people. So I would just say that, don't do it as a regular thing or as like a prophylactic thing, something to prevent injuries, because it's probably just going to be blunting the training response that you're looking for. However, I had not looked at the evidence on this in a long time, and I thought it'd be a good opportunity. And I did come across a really nice study that was released in 2023. So actually, it was a review. So they reviewed a bunch of studies to date. So this was by Yves Panon in the British Medical Journal in 2023. And what they did is essentially just looked at all the studies on running and the use of ibuprofen to see what are the actual like medical risks of this. Is it a dangerous thing to do, and what evidence do we have for that? And the studies kind of zeroed in on a few specific things. So the big ones were hyponatremia, acute kidney injury, and gastrointestinal disturbance, among some others. So hyponatremia, that's like electrolyte imbalance that can be quite serious and dangerous in certain circumstances. Kidney injury, obviously, and then GI distress is mainly because ibuprofen use long-term among the general population for like, if you have like an arthritic knee or something that hurts all the time and you're taking ibuprofen regularly, there is, from what I understand, reasonably good evidence that causes GI problems. So the sort of inference is that if you're doing it for running events, especially if you're doing it regularly, then you may be at risk for GI issues. And, reading through this study and the conclusions that the authors came to is that there wasn't a massive deal of evidence. There wasn't a great deal of really compelling evidence that it's super dangerous to take ibuprofen before running. So in their words, it was none of these sections had clear, statistically significant links with non-steroidal use in ultra-endurance running, which was the focus of their things. However, potential links were shown, especially in acute kidney injury and electrolyte imbalance, which would be the hyponatremia one. So what they were essentially getting at was there's no, in the evidence that they reviewed of these 30 studies, there was no massive smoking gun. This is really dangerous. It's going to mess up your kidneys, or you're going to, get hypernatremia the second time you do it. Like, it wasn't really bad, but there was enough evidence there to say, there seems to be something going on here, and this potentially could be dangerous. And then the interesting thing, they touched on it in this study, but there's more evidence elsewhere. I'm not super familiar with it because I haven't looked at it a lot, but essentially looking at, like, does ibuprofen actually help? Does it help you improve your recovery? Does it reduce post-exercise like soreness? Does it improve your performance on race day? And there's extremely limited evidence, if any, that it actually does any of those things. So the things that the runners might be doing this for, it's not actually doing those things. So then if there is like very little benefit to it, or maybe no benefit to it, and then there's any risk, especially if even if there's only a small risk, but it's a small risk of a serious event, it's like, well, why do it, right? Why take even a small risk of a serious problem if there is no benefit to it? That would be kind of the takeaway for me from reading this study. So if I were to give my 2 cents on this whole controversy in the last few weeks, I would say that the sort of backlash that I saw to these posts and these influencers was maybe a little much, given that one of them, the reel in question, was, the sort of format of it was this young lady was having period cramps and then took Advil so she could go and do her track workout. Like, that was the kind of storyboard of it. And then the other one, like, is I'm a little bit less sympathetic to, which was, she was tired and it was hurting in her workout, so she sits down, pops a couple of Advil, and then just powers through the rest of the workout. Like, I would say the first one is a slightly more forgivable. Not forgivable. It doesn't need to be forgivable, but it's a more reasonable use of something like Advil or ibuprofen, is to say, okay, well, I have period pain and I want to do my run, so I take it so I can do my workout. The other one, where it's like, I'm doing a run and it hurts, so I'm going to take the pill so I don't feel it and I can keep going. That one seems to me to be a little bit less reasonable, given the fact that to date, there's very little evidence to say that taking ibuprofen will actually improve your performance in that workout. And there is a little bit of evidence to say that you might be risking things like acute kidney injury if you were to do it, especially if you were doing it regularly, just because that increases, like, the more times you do it, the more times you have to take that small risk, right? And then finally, since the training effect is mediated or like initiated by an inflammatory response, taking medications that are designed to suppress that inflammatory response doesn't make a lot of sense to me, unless there's really compelling evidence to say why it's helpful. If we know that that's how the training effect works, why would we want to suppress that effect unless we have some other really compelling reason to do it? So that's why I think the example with the menstrual cramps is more reasonable, because, like, she couldn't have done the session, arguably, or couldn't have done it as well had she not taken the Advil. But the other one, where it's like, I'm doing this training session and it's hurting and then I take the Advil, well, then when you go to sleep that night, any training effects that you have from that session are going to be blunted because you took that medication. So the fact that you could do more workout may be a wash, it may be a negative effect, because you can't adapt to that training anyway. So my takeaway from the evidence so far, from looking at the reels and the controversy, is like, it's probably not as dangerous as some people were making out. However, there does seem to be some risk to it. There seems to be almost no benefit to it. And certainly if you're doing it as what we call a prophylactic, where you're taking things like ibuprofen or like Advil, non-steroidals and things like that regularly in order to stop things from happening, right? Like, stop yourself from getting sore during a run, or stop yourself from feeling pain during a run or on race day. If you're doing that regularly as a prophylactic type of thing, that's probably not a very good idea. And there's a bit of a risk to it that you'll have some sort of serious health complication. And that's where I sit on ibuprofen. And the interesting thing about this for me is I always have this little battle with myself, because sometimes if I do like a really hard workout, particularly like the things I get the most soreness from is like long runs, or if I do a strength session that involves a lot of kind of shoulder things, like pushing weights overhead. I know that you guys are runners and you don't do stuff like that, but you should. Sometimes the next day, either my legs will be really sore or my neck will be sore. If my neck's sore, it'll tend to give me a headache. And then I'm always like, I could take an ibuprofen and the headache will be less, but then my training adaptations will be blunted and I won't get the benefit from doing that workout in the first place. So it's always a little bit of a battle for me to not do it because I'm just like, just put up with the headache so that you can get those training effects. Yeah, ibuprofen, it does blunt the training response. That's the actual defined, mechanism of it. So it's not that useful in terms of like helping you with your training. If it is, reducing pain to allow you to do more running, I would say if that's from an unrelated thing, like menstrual cramps is a good example. And I'm not an expert on that, but like that seems like more reasonable. If you're taking it because your knee hurts and you want to run more, I would say if it allows you to a little bit of running and just kind of get going, as long as it's done in conjunction with your health professional and you're doing it like in a very systematic and guided temporary way where you may be using it for a couple of weeks to allow you to run a bit more, to then use running to build the resilience to then get off it and just go back to normal running without the pain, then that's more reasonable. But it's not a long-term solution because there is a little bit of a risk to it.